Hi, I'm Stephen from Feathers from Perception Programs. Perception Programs is a mental health substance use treatment organization that is primarily based out of Willimantic, but also has offices in Danielson stores. My department is risk reduction outreach. So what we do is we go out and actively work with people who are currently injecting substances and try and make sure that they have supplies to use safely, testing and education around HIV and hepatitis C, and connections to treatment. We do this in all of Windham County and northern New London County, so that's Norwich, Jewett City, and then all of Windham County. Our services are primarily focused around two areas. So the first one is HIV and hepatitis C, so that's bloodborne pathogens. We offer testing for those and education around them, so we teach people about what they are, the risk factors, how they can reduce their own risk, and also keep themselves and their community safer. We offer testing as well. We do rapid testing, which takes about 20 to 25 minutes. So we can do that rapid testing anywhere from our office to out in the fields to somebody's home or apartment. We also have an additional rapid test, which is primarily targeted at people who are active substance users. And that rapid test actually takes less than 5 minutes from the person deciding they want to get tested to having results for them, as opposed to the 20 to 25 minutes. As a final option for testing, we do also offer an in-home HIV test, which means that we can actually just mail it directly to the individual who's at risk for HIV. They can test themselves at their own home, at their own convenience, and then we can work with them following that. So anyone who tests with us, we can work with them as case managers, either to connect them to the medical care that is appropriate for their own medical needs based off of their reactive results, or if they are non-reactive, we can work with them to provide them with preventative materials, either over the counter or connect them with a prescriber, because there are now prescribed medications called PrEP, which reduces the chance of contracting HIV by over 90% if taken as prescribed. So, the other part of our services primarily focuses around the syringe exchange. The syringe exchange provides free sterile supplies to individuals who are currently actively injecting substances, and then we also collect those supplies back to make sure that they aren't out in the community and that they're disposed of properly. We provide those supplies, from the needles to the alcohol swabs, everything to help try and keep the individual as safe as possible while they're still actively using. We also work with them to connect and make sure that they have the option and the knowledge that we can connect them with mental health services, substance use services, and detox services, as well as medication-assisted therapy when they're ready for those services. And as soon as they say they're ready, we work to try and make sure they get there, whether that's from just making the call with them to actually providing them the ride to that treatment or detox center if that's what they need. We also finally provide Narcan. So when the state has supplies, we get Narcan, which we can give out to the people who are actively using in the community to make sure that they have access to that drug that reduces the chance of dying from opiate overdose, because it can reverse the overdose and bring the person back to life, allow them to breathe on their own. So we do full trainings on Narcan for people in the public, as well as individuals who are living with or actively using themselves. And then we can provide them with Narcan kits, or if we don't have Narcan, we can teach them about how to go about getting Narcan and where to get it. All of these services are provided totally free of charge, and they are provided in multiple different ways. So our syringe service program, we have fixed site locations where we're at every single week. So every Friday, we're in Jewett City from 1 to 3. Every Tuesday, we're in downtown Norwich, and Tuesday morning between 10 and 12. And every Wednesday, we're in our Willimantic office from 3 to 5:30, so people can always find us there. And if they can't reach us at those times or locations, they can also give us a call, let us know somehow, and we can actually come out and meet them either at their own place or at a place that's neutral and convenient and safe for them. And then we can provide them with any of the services that they need, whether that's HIV or hepatitis C testing, Narcan training, and or syringe service programs. So that's all from me, and have a wonderful Christmas season.